We are talking about ending homelessness in Washington, D.C., lessons learned from a sister city. They are co-participants with us in the Built for Zero initiative. Honolulu has been participating with Built for Zero as getting technical assistance from them. They help us do a lot of strategic planning around how our approach to ending veteran homelessness in Hawaii. And it's one of the most helpful things about Built for Zero is listening to other cities who are in, of similar sizes, similar housing costs, similar challenges, and really hearing what their approach is. We can always learn a lot from that. So we have Kally Canfield from Built for Zero, and we have Lindsay Curtin, who's working there in DC. So I'll go ahead and hand it over to them.
All right. So thank you all for being here. It's such a pleasure to join you. I'm Kally Canfield, as Andy mentioned. I'm with Built for Zero. And today we're talking about lessons learned from a sister city. I work on the Built for Zero team of Community Solutions. Some of you might be familiar with us, as Honolulu, as Andy mentioned, is one of the communities that we work with. Just a little bit more about me before I pass it over to Lindsay. I'm currently part of the large city cohort with Built for Zero, and I work as a systems transformation advisor. I work with the cities of Charlotte, North Carolina, Atlanta, Georgia, and Washington, D.C. My focus with these communities is to reduce and end veteran homelessness and making system-level improvements in order to do so. Prior to joining Community Solutions a little over a year ago, I was the director of a very large SSVF program in Washington, D.C. with a local nonprofit, Friendship Place. I worked in SSVF since it started back in late 2011 up until transitioning to Built for Zero. I remain very involved in the community leadership groups within the district working to end homelessness and work closely with DCICH Veterans Now Work Group. With that, I'm going to pass it over to my awesome co-presenter, Lindsay Curtin.
Thank you. Sorry about that. Computer issues already. Can everyone hear me? Kally, can you hear me?
Yeah, we can hear you.
Perfect. My name is Lindsay Curtin, and as Kally mentioned, I'm a policy advisor with the DC Interagency Council on Homelessness, and I specifically focus on single adults and veterans. For those of you who don't know, the DC Interagency Council on Homelessness, or the ICH, is a group of cabinet-level leaders, providers of homeless services, advocates, homeless and formerly homeless leaders that come together to inform and guide the district's strategies and policies for meeting the needs of individuals and families who are homeless or imminent risk of becoming homeless in the District of Columbia. And I will talk a bit more about my role with the DC ICH as we go throughout the presentation, as well as the ICH structure and how it affects everything that we're talking about today.
Thanks, Lindsay. So just to give folks an idea of what to anticipate on this webinar today, I just wanted to go through a little bit. We already did our welcome and agenda. We're going to talk a little bit about DC, where we've been, where we are, regional coordination, HUD-VASH, and SSVF coordination, and outreach. So as we go through this, feel free to put in your questions in the chat box or in the Q&A box, and we hope to have some time to answer at the end. All right, moving on to DC in review. I'm going to show you our data for the past 2 years. As I mentioned in my intro, DC is a part of the large city cohort with Built for Zero. This cohort was created in 2019 in order to figure out what it takes to end homelessness in a large metropolitan city. And we're hoping to spread the learning that we gain from this cohort to other large cities. The primary goal is to demonstrate that reaching an end to homelessness is possible. As you can see from our data above, that would have been a decrease from 365 in December of 2018 to 183 in December of 2019. And you may notice that we did not meet that goal. That was a very ambitious aim that we set. We ended the year at 346, which was just a 5% decrease. So even though we didn't get close to meeting our goal, we have made a lot of progress and have significantly strengthened our system and have many lessons that we've learned. So in setting our 2020 aim, the aim for this year, we decided to look at trends in our data in order to better inform our goal setting. What trends do we see year to year since we've achieved quality data? What is our average monthly inflow and outflow? What projections do our housing providers have in regards to how many placements that they're able to house from our by name list on a monthly basis? With all this information, we ended up determining that we would be able to have a goal to decrease by 100 veterans by June of 2020, which would have been from 346 in December of 2019 to 246 in June of 2020. We were just 3 veterans away from meeting this goal. We also decided to have a 35% reduction goal for the full year of 2020. We currently have 243 veterans on our by name list and are hoping to be below 226 by the end of December to meet or exceed our goal. Now, while we have nearly achieved our reduction goal, being at 30% reduction for this year, we celebrate this very lightly. With the unknowns that come along with a global pandemic, the questions of if our inflow and numbers are artificially deflated, who are we missing? And the historical data that we have shown that we have an increased inflow in the winter months, which is something maybe you don't experience as much in Hawaii. We are uncertain of what lies ahead and are very reluctant to celebrate. The next slide, and this is just a breakdown from month to month over the last 2 years. You can see those little red dots on the bottom and the little gray dots. And the red dots demonstrate that we had higher inflow into our system than outflow during that month. And the gray dots mean that our outflow exceeded our inflow. So we had more veterans leaving our system than entering our system. So ideally, we really want to have more of the gray dots below, which is, I mean, the more gray dots we have, the closer we'll be getting to reaching functional zero. So during the remaining of this presentation, Lindsay and I are going to share about 3 challenges that we faced, the actions that we took, and the lessons that we learned. And we imagine that some of these might sound pretty familiar to you, being another large metropolitan area, such as similar to DC in many ways. So Lindsay, I'm going to kick it over to you.
Perfect. Thanks, Kally. As a little introduction to this section, with our goal of sharing lessons learned with you all, we thought it might be helpful to touch on a few of the challenges that our veteran system has faced, what actions we've taken to try to mitigate those challenges, and our lessons learned from the processes that we tried to implement. As a level-setting note, I mentioned that I work for DC's Interagency Council on Homelessness. The DC's Interagency Council on Homelessness hosts multiple community, committee, and work group meetings each month, which are attended by providers, government partners, advocates, those with lived experience of homelessness. And our veteran system has a work group within that structure that meets once and sometimes twice a month. Those meetings is where we've surfaced many of the challenges that we're going to talk about today. And then we also use those meetings for the group to work to design potential solutions and that we were able to work to implement. So as you can see on your screen, regional coordination has been something that we've been working on. Inflow is a significant challenge in the district. It's one of our biggest challenges. As a way to illustrate this, just to give you an example, between our 2019 and 2020 PIT counts, we housed more veterans than were counted on our 2019 PIT count. But due to our average inflow of about 50 new veterans each month in that period, it's difficult to actually reduce the number of veterans experiencing homelessness in the city. So as you can see, the district draws in individuals and veterans from surrounding counties due to many different reasons. I'm assuming with you guys being a large city, some of these things are very similar. We have the largest number of shelter beds in the area. We have the largest number of GPD beds in the area. And obviously, there are just other resources that cities provide for individuals that draw people in towards the city. District's also a little different. We do have right to shelter laws, which can bring people into our city when there's not shelter beds in some of the surrounding areas. Individuals might come into DC specifically for that reason. Another thing that makes us a little bit unique, but I think similar to many other large cities, is DC actually sits between 2 states, Virginia and Maryland. So our suburbs are actually not part of our state. Our suburbs are Virginia and Maryland, and we have about 8 counties that we're working with in Virginia and Maryland, where a number of veterans and individuals are often coming from and into the DC system. As we know that inflow was a big issue, one of the things we were really interested in was how many individuals in our GPD programs were actually coming directly from other counties and the surrounding states. So we actually did a survey of one of our GPD providers, our largest GPD provider, and we found out that 46% of the veterans in that GPD, in GPD there, actually came directly from outside the district prior to their stay in GPD. Some of those individuals obviously could have come from all over the country, you know, one maybe from California or one from Maine or something along those lines, but a majority of those individuals, at 46%, were coming directly from the areas surrounding the district, so our suburbs. And one of the reasons that is they don't have as many GPD beds there, so they're often referring individuals into DC's GPD system. So as I move on to the next slide, I want to talk a little bit about what some of the action steps that we took to try to mitigate this challenge of this inflow. So we started with some data collection and referral. First, when individuals came into our veteran transitional housing programs, our GPD programs, we actually added some questions to the HMIS intake. So we started asking things like where they were housed or experiencing homelessness directly prior to entering the GPD program. We also asked where they'd like to be housed. For example, were they originally from DC and had just been in Maryland for a few weeks prior to entering GPD, and was DC actually their home and where they wanted to be housed? So we wanted to get an idea of those things when we collected this data. If a veteran was coming from a surrounding county, we would actually work with that county with their coordinated entry and VA outreach leads, as well as the provider working with the client to see if maybe it was appropriate for the veteran to be added back to their by name list. But we would continue to provide them transitional housing in the GPD program, even if they were added back to that county's by name list, because that is where they were from and that is where they wanted to be housed. We also worked on some data sharing. So we tested a data sharing agreement with a surrounding county because we were interested in actually seeing how much overlap there was on our by name list. Were there people who were going back and forth on a regular basis? And maybe we're in one shelter one night, another shelter another night, in these different jurisdictions. And we also worked on some detailed policy development. We did try to create a detailed policy with one other county to think about things of if one person had a housing history or homelessness in one county, but desires to be housed in another county, or when a client was on both counties by name lists, what really made sense. In addition, we added a case conferencing criteria to our DC coordinated entry system. We wanted to ensure that individuals that should be on DC's by name list were, so we allowed other counties to bring cases to us so that we could add people back to our by name list if that's where they should be. So moving on to the lessons learned, this policy has been pretty successful overall. Veterans from around the metro area have been able to be reconnected to their home jurisdiction's by name list if that's where they want to reside. And we've actually seen over 100 individuals moving to the by name list of where they were directly from and where they want to reside. I don't want to say that we've completely solved this issue. There's obviously still work to do, and there are also other things to address when it comes to inflow. But when it comes to regional coordination, some of the things that we're still dealing with is when you're working with multiple different counties, sometimes different counties have different laws to navigate, have different policies that they follow. So being able to navigate each of those different counties' policies is something that we are still always working on. And also, we are currently only implementing this process within our veteran-specific transitional housing and our GPD programs. We're not implementing like these intakes where we ask about where people are from in our shelter system or in our non-veteran specific transitional housing. And I can pass it back to you, Kally.
Yeah, thanks, Lindsay. So I'm going to talk a little bit now about some of the things that we've worked on with HUD-VASH and SSVS coordination. And just for some context, the Washington, D.C. VA Medical Center serves 9 counties. So they're located in Washington, D.C., but they serve a large COC geographic area. And we have 3 main providers that serve veterans in Washington, D.C., but they too serve multiple of the neighboring counties to us. So I just wanted to give a little bit of context there. Some of the challenges that we've come across is wanting to increase SSVF housing placements within the district from our by name list. So after looking at some data as a community, we realized that there was a need to be a little bit more focused on this and increase that, increase our housing placements from SSVF providers. We also had a lot of, or do have a lot of unutilized vouchers within the district. So we've been unable to match all available vouchers in our community, largely due to staffing challenges. And I think that's a pretty widespread issue nationally, where we were experiencing some staffing challenges for the HUD VASH programs. So some things that we've done, some actions that we've taken, is our local SSVF providers have set a collaborative goal of housing at least 15 veterans a month that are on the DC by name list. We track this on a monthly basis, and we discuss strategies when we don't meet the goal and try to understand what the reasons are behind that. As it relates to unutilized VASH vouchers, we've had SSVF providers and the HUD VASH team. They've developed a partnership to utilize SSVF case management to support with veterans obtaining the voucher and moving into their units, and then eventually transitioning over to the VA case manager when they have availability. So recognizing that we want to continue to use these resources and supporting our VA medical center in doing so. So part of this plan includes a regular scheduled meeting between our SSVF providers and the VA to review the cases that SSVF is working with that are HUD VASH cases and discussing any clinical needs that they have. We've also worked with the VA to brainstorm ideas to identify ways to expedite their hiring. So when it comes to lessons learned, I think that setting community-wide goals is something that we realize is really important, and that's something that we've done largely as a community with setting our annual aims, our reduction goals. So even taking that a step smaller and setting those goals as a community for programs has been really powerful and creates a collective ownership in accomplishing them. One thing we have noticed is that sometimes the goals don't trickle down to the frontline workers that are set, so we know that it's really important to bring the people that are actually doing the work along in the goal setting process. It's good to keep in mind, sometimes you're not going to meet your goal, and that's okay, and you just have to think about what did you learn from this, what can you build off of, what improvements did you see, and just always problem solve and brainstorm. Don't be afraid to try new things, test some small things, small tests of change, and embrace failing forward. When it comes to the unutilized VASH vouchers, coordination and communication is key. Working together towards the same goal, building relationships, developing partnerships, finding ways to work through red tape and barriers that come across along the way. I think that our partnership with the VA is incredibly strong, and as a community, I think we're really lucky to have that relationship and to be partners in this. Without them, there's no way that we would be able to see reductions that we have achieved, and we would not be able to end veteran homelessness in DC if they weren't a key player at the table. So Lindsay, I'm going to pass it over to you to talk some about outreach.
Great, thanks Kally, and thanks for that. And I appreciate your shout out to the VA. We are very lucky to have a VA that works so closely with us and that we are able to have such a great partnership with. It really makes a difference in all the work that we do in our city. And I think it's just another point about how great it is that we have so many different people around our table, not only when we're surfacing challenges, but when we're trying to solve for them. It's wonderful to have the VA at the table, but also so many other providers that can provide insight as well. So jumping into outreach, coordination has always seemed to be one of the biggest issues when it comes to outreach. Both veteran-specific outreach and non-veteran-specific outreach. We are actually really lucky in the district to have a large number of non-veteran specific outreach teams that are locally funded by our government. We have a significant amount of outreach funded through our Department of Human Services as well as our Department of Behavioral Health. So it's really great that we have that as a resource. I think the things we have to think about is then how we are coordinating with those resources. So when it comes to veteran-specific resource outreach, we had some challenges where veterans were being engaged by multiple different agencies, while others may have been missed on the streets. And what we actually realized would be really important to set catchment areas for our providers. As Kally mentioned earlier, we have multiple SSVF providers serving our continuum. And so what we did was our regular outreach, our non-veteran focused outreach teams have catchment areas across the city. We decided to do that with our veteran-specific outreach teams as well, to ensure that every part of the city was being outreached specifically for veterans, but also so that one veteran wasn't getting touched by 5 or 6 different outreach teams. The other challenge that we faced was for non-veteran specific outreach teams. Our non-veteran specific outreach teams were not always aware of the resources available to veterans and how to connect them to these resources. We had, as I mentioned, outreach teams that were covering the whole city, but we wanted to ensure that they really knew how to work with our veterans to get them connected to resources as quickly as possible. So to solve some of these challenges, we tried to implement a few different actions. So as I mentioned, with our veteran outreach teams, we actually assigned providers catchment areas so that each provider would cover one territory of the city. We also created in-reach schedules. So for areas where we know our individuals experiencing homelessness, our veterans experiencing homelessness spend time, like shelters, like day centers, we scheduled an in-reach schedule so that we didn't have multiple SSVF providers going to one place on one day or potentially confusing veterans by having them talk to multiple different providers. That is something that we've seen been very helpful. When it comes to our non-veteran specific outreach, we developed HMIS data entry workflows for outreach providers to ensure that all the veterans that they were working with got added to our by name list. Again, we have a number of outreach providers across the city, and we're lucky that they all do use HMIS. So this was not a very hard thing for us to do. It was just implementing a workflow to individuals who already use our HMIS systems. In addition, we mapped out a process for how veterans who are identified by non-veteran outreach teams could get connected to the VA team and so their veteran status could be verified. This was very straightforward in a way to ensure that information could be passed around to all new outreach providers across the city and that there was a process they always knew to follow. In addition, we invited non-veteran specific outreach providers to attend our veteran CAP meetings. Our outreach providers generally attended the singles CAP meeting. We invited them to start attending that veterans CAP meeting to help provide expertise on the clients that they were working closest with if they were veterans, but also to help with the coordination, being able to see people face to face and have the veterans provider right there in the same room as the single providers and being able to coordinate regarding their clients. Finally, we created a Veteran CAP 101 training for all veteran providers and non-veteran outreach providers. This is in addition to our normal HMIS training, which our providers go through. This focused on many different topics, but specifically how singles outreach providers could refer to veteran-specific resources like transitional housing and GPD, like SSVF programs, especially since our CAP systems primarily focus, our veteran system CAP is primarily focused on matching individuals to vouchers and to other PSH resources. And we've actually seen this be pretty successful. We've had increased coordination between our veteran providers, and it's been really helpful for them to be able to know that when they see someone on one day, another SSVF provider, a different SSVF provider, isn't going to be seeing them the next day. We've also really seen a lack of that overlap, as I mentioned. It's been really nice to not be worried about people getting 2 different messages or being confused by the different groups that they're seeing. It also ensures that we're able to catch all people in our city so that no place is being missed. The presence of our singles outreach teams at CAPS meetings has, I think, been a huge win for us as well. It's been really exciting to see the collaboration that's able to happen right in those coordinated entry meetings, right in those match meetings, to talk about how we can match our veterans and connect them to that veteran provider. It's also been really nice to have the expertise of the outreach providers in the room, the non-veteran outreach providers, to really talk about the needs of their clients and what resources really might be best for them. Also, we have heard that our non-veteran providers really feel comfortable now making direct connections to our veteran programs. They feel like they understand what those programs are and know exactly how to get individuals connected to get them the resources they need as quickly as possible. So I think we've seen a lot of wins on the outreach side. Obviously, there's always still work to do. I think probably as everyone on this call knows, coordination is always a work in progress. So always ensuring that we're able to continue training on the veteran processes and ensuring that those connections continue to be made between our non-veteran providers and our veteran providers is something that we strive to keep working on.
Thanks, Lindsay. So I think we can turn it over for questions. Anything you want to know about what we talked about today, or anything at all about DC that you have questions about? Feel free to type them in.
We appreciate Lindsay and Kally. The question I had was anything specific that you folks have. I think one of the main challenges that we see is just our high cost of housing here, and just the overall lack of affordable housing in the rental market. And if you folks have made any progress in that area as far as identifying more affordable housing options, or how you go about doing that.
Yeah, I think that's a constant struggle that we are faced with in the district, and very similar. So I know something that our housing authority did is they changed the amount that the vouchers could be utilized for based on neighborhoods. So in the past, it was easy for landlords to just raise the rent high enough where it would still appeal to the general public, but be out of reach for the housing choice vouchers. So the city made a really great change of, I don't know, Lindsay, was that 2, maybe 3 years ago? So now
exactly right.
Landlords can't raise the rent high enough because they wouldn't attract the market. The vouchers cover what they would ask for. So that really helps with landlords who are trying to screen out, I think, voucher tenants. Mm-hmm. We've also developed some single-site permanent supportive housing units. One recently opened in, I want to say, December, January timeframe. That was it 75 veterans?
Yeah, exactly right.
That we were able to move in there, and they also didn't have the requirement. They weren't with VASH vouchers, VASH subsidies, so we were able to house many of the veterans in our system who were not VHA eligible. That was a great resource that came online recently, and we've had another one in the past, the Jill Kerr Conway building, that we were able to also house. I believe it's a 70, I think it's 70 units, and about half of those were for permanent supportive housing. It's a mixed unit building. So that really helped having those come online. And Lindsay, I don't know if there's anything else that I'm missing. I know room shares and getting creative with identifying landlords who would work with the various programs. I'm sure you all already are doing that. Looking outside, one benefit I think that DC has is that we have neighboring counties that are a little bit more affordable. Not all, but with SSVF flexibility, they've been able to help veterans, if they are interested, find units that are more affordable in neighboring COCs as well.
Yeah, I think everything Kally said is exactly right on. And I think some of the reasons why we did try to work on some project-based single-site buildings for our veterans, as Kally mentioned, one specifically with VASH vouchers who are VA eligible, and one specifically for those veterans who may not be eligible for VASH vouchers. One other thing that we've done as a system that's not specifically for our vet system, but for the system overall, is we actually have a landlord working group where we're working on engaging landlords, and really trying to learn more from them and try to get some buy-in from them about our programs so that they really are willing to work with us for those individuals who may have VASH or PSH vouchers, but also individuals who may be in SSDF or rapid rehousing style programs. And we've put some things in place to try to help with that. Things like landlord prevention funds and things like that to really try to partner with our landlords. But as you said, that doesn't always mean that the cost of the unit actually goes down. But the fact that we did raise the voucher limits in different parts of the city not only allows people to go to different parts of the city, but it really allows individuals to not all just have to look at one small part of the city. We have people now over all wards of our city, and we've really seen that change since those voucher limits changed.
Yeah, and that's right, Lindsay. And I see a question that came through. I know, Andy, you're moderating those a little bit, but I think I could touch on, has the VA ever considered building a housing facility that would contain on-site medical outreach, rec programs, et cetera? I don't know the answer to that fully, but I do know that the Jill Kirk Conway building has on-site case management from the VA since they're filled with the HUD-VASH vouchers. A lot of them do have different groups and rec programs involved. The Walter Reed building that opened in January or December of last year, they have a lot of the stuff on site as well.
Yeah, that's right. The Walter Reed building that Kally mentioned does have the ability to have nursing on site and has the ability for case management as well, even though all of those may not be directly through the VA.
And in Hawaii, locally, the closest thing we have to that is we have a site out at Barbers Point, the U.S. vet site there. It has permanent supportive housing with a lot of HUD-VASH veterans living there. They're building additional buildings of permanent supportive housing there as well. And then we also have our transitional housing and emergency housing beds there. And with that, we also have probably 30 or so VA homeless program staff that are housed there on site. We're also in the midst of developing a small clinic space there for our homeless patient-aligned care team to use to see veterans out of. So we are on the verge of offering on-site medical care there as well. And then we do our social workers and occupational therapists and things like that doing social events and trying to organize groups, especially during the pandemic. A lot of those we've tried to do virtually. The participation hasn't really been there, but you're really trying to build more of a community there. And I know as they build more buildings on that site, the intention is to offer services within each residential building and offer space for offices and care to happen with the vision that it would all kind of happen there on site. Good question.
That's wonderful.
Yeah, I think we've something we've explored or talked about a little bit is like what could we do to maybe buy or have like master leasing? I don't know if you all have explored that at all, but master leasing units
yes, through
a provider to more quickly be able to house people without the barriers that a lot of landlords put up.
Yeah, I heard you mention something about shared housing as well. Since we don't have any more questions, I'm going to hog the question time with mine. So if you have any insights on master leasing or shared housing or micro units, things like that are maybe more non-traditional types of housing, a Hawaiian concept of kauhale housing, which means basically like a village housing where you have shared communal space with micro units around it, is something that we're working on here in a few different areas, or that's an idea that's been kicked around. But anything along those lines that maybe is a little more outside the box are all things that we're entertaining but haven't necessarily been successful in, or we're in the process of implementing those things. So we'd love to hear what's happened in DC in those kind of efforts.
I think we're probably thinking about a lot of the same things, being from these high-cost areas, like you guys in DC, where it's just hard to afford a unit. Our SSVF programs obviously often are looking at things like shared spaces. In our singles rapid rehousing programs, we're also looking at those things and even thinking of more formal programs for shared housing, especially for those individuals who may not have a permanent supportive housing voucher where they can, take it and people know that they're going to get the rent. So I think that's something we've definitely been exploring. We've also, in our buildings that we've been building for veterans, a lot of these project-based buildings, we have made them slightly smaller units so that we're able to get more veterans housed. A lot of these buildings are slightly more like efficiency style. They're all nice and new and look really nice, but they aren't as large. They are that slightly smaller sized unit, making them obviously more affordable, but also so that we're able to house more veterans. Kally worked really closely on the SSVF side, so I can let her talk a little bit more about that part.
Yeah, I think like Lindsay said, we're thinking about the same things. And I know one benefit to DC is the row homes often have English basements, which individual owners often convert into apartment buildings or apartments as well. And I think that's been a benefit for SSVF providers to be able to utilize landlords in that sense, more private landlords with renting out their units. I know we've talked a little bit about like what could we do for more accessory dwelling in the city, and we haven't really, Lindsay, I don't think we've come to any action on that yet, but it's definitely something that's always on our mind.
Yeah, and I think one of the things, yeah, I think that's exactly right. And I think one of the things that's always hard is, and you probably know this, in a city, it's often hard to build out. What we have more space to do is build up. So some of those things that may look a little more unique in other places might look more like buildings in DC. But that doesn't mean that, like you guys, we aren't thinking of lots of different models.
Yeah, and building up in DC too has its limits. We can't build higher than the Capitol building, isn't that right, or is that just a rumor? I don't know.
No. Yeah, no, there are limits to how high you can build in DC without paying additional taxes and things like that.
So hopefully that was helpful, Andy. I don't know.
Yes, yeah, that's good to know. Yeah, for sure. And I think from a city policy standpoint in Honolulu, I think we've recently passed an accessory dwelling unit law, allowing for folks to build more kind of mother-in-law, or we call them ohana units, out here on their properties to rent out. There's been efforts to kind of curtail a little bit of the Airbnb vacation rental kind of things are in certain residential areas to kind of put ease the overall burden on the rental market and kind of maybe hopefully loosen up the rental market a little bit more for local residents. And I'm sure that it sounds like probably a lot of similar efforts, but always good to talk to another larger urban folks from another larger urban area. Just a lot of the same policy things that you were looking at, or the bigger picture efforts and the different creative kinds of housing that we're looking at. So excited to be involved in Built for Zero. And speaking of which, in about, looks like we're about 8 minutes out from our closing plenary. So we're going to be hearing from Nate, who's worked with us for years as our partner in Built for Zero, and he'll probably talk about a few of these things about the future of where we're going to go with veteran homelessness. So yeah, hopefully we can have learning sessions again in the future. And with Built for Zero and Gather, that's always a good opportunity for us to interface. But
yeah, we'll have a virtual one this fall. So
yeah, right on.
I was just going to say, if things don't have to be virtual in the future, we'd be happy to come on out and have a meeting in person.
we have no shortage of people offering to come out and offer us technical training. We are always chosen when we put in an application for trainers to come out. So, and yeah,
and I wouldn't call myself a trainer. Just idea exchange. Feel free.
Oh, right. Yes, exactly. Thanks, everybody, for joining us. If you can go back to the website, please do join us for the closing plenary. Find the link for that, and we'll see you there. Thank you.
Thank you.
Thank you.